Today I'm going to spend some time talking about concussion. Now, on the clinical side, concussion is also referred to as mild traumatic brain injury. So, MTBI, that's the acronym that's used to refer to concussion. Mild, only in the sense that generally concussion doesn't result in death. But otherwise, if you look at the symptoms, they can range from mild on one side of the spectrum to really quite severe. We're going to take a look at some of the symptoms of a concussion and also talk about what the impact of having a concussion on a person's life can be. So that's the topic of our discussion today. Before we move on to symptoms, let's talk about how a person might sustain a concussion. A person might sustain a concussion if they receive a hit to the head or a hit to the body that causes the head to shake in a violent fashion. How it works is, let's say, this is your head, and this is your brain inside your head. Say if your head sustains a hit or your body sustains a hit that causes your head to shake violently, well, what can happen is the brain inside the head, which is a hard surface, can hit the hard surface of the head. So the brain is a soft substance, and it can hit the hard surface of the head on the inside, and as a result of that, it can experience an insult, an injury. So that injury can cause certain symptoms, which we would refer to as concussion. So when we're talking about symptoms, what are some of the symptoms that emerge when a person has a concussion? So the symptoms tend to vary from person to person. And like I said before, symptoms can be mild and may last, a week, 2 weeks, and dissipate completely. On the other hand, they can run on for sometimes months and even years. Certainly, I've had lots of patients like that who've been living with symptoms of a concussion for years, and then on the other hand, people were diagnosed with concussions, and within a month or two, they had bounced back. Here are some of the symptoms that typically occur when a person has sustained a concussion. A person may experience headaches. They may experience migraine headaches, or they can experience both of them, headaches and migraine headaches. They can experience nausea, dizziness, vomiting. They may have problems with balance. They can experience blurry vision. People with concussion can also experience sensitivity to light, which we refer to as photophobia. They can also experience sensitivity to sound, so they may have a hard time being in places where there's a lot of noise, in social gatherings, for example. Some people talk about difficulties with word search, so they can have that problem. They can't seem to find the right word to describe something. You can even experience confusion, a sort of disorientation, a general feeling of unwellness that can be part and often is part of concussion. Just generally not feeling very well. They may feel foggy or sluggish, and a lot of people talk about memory impairment, having trouble with their memory. These symptoms can last, like I said, they can last from a week, 2 weeks sometimes, and on the other end of the spectrum, they can run on for months and even years. That takes us to why it is that I'm talking about concussion. I see patients with concussion quite frequently, and for many of them, it has had a really profound impact on their lives. Some of them have lost their driver's licenses. They cannot drive because they're experiencing blurry vision or dizziness or nausea, and so they become a risk to themselves and to other motorists, and as a result of that, they've ended up losing their driver's licenses. And you can just imagine what impact that would have, on a person's life if you ended up losing your driver's license. So I've had patients who ended up losing their jobs because of their dizziness, the nausea, sensations of vertigo, where they feel like literally they're sort of falling through the floor. They don't have a good sense of balance, causing literally chaos in their personal relationships, in their social relationships, on the occupational side, on the work side. So the consequences can be quite significant when we're talking about a concussion. Now, what is the psychologist's job in all of this? It's a very multifold job. Generally, when we're talking about a concussion, it's not apparent, on a person's body that they have a concussion. So they they can have a hard time really getting people to believe that they're going through all of this, and people don't understand what they're experiencing. One of the tasks of the psychologist is to provide support to a person who is experiencing and living with a concussion. But aside from that, there are many other factors that a psychologist has to address. You can just imagine mood would be a huge issue. It's up and down because their life is literally in a state of chaos as a consequence of the symptoms that they're living with. And very frequently, anxiety is a very significant concern. There's a lot of stress in a person's life as a consequence of this issue, this one issue alone. And they may have other concerns, chronic pain, for example. And then, like I said, they may end up losing their jobs. They may not be able to drive. What happens to your children that used to drive to school? And, who does the grocery shopping? Recreational stuff. That just goes out the window for many people. So stress can be a huge factor. Strain can build up in a relationship as a result of the symptoms that the person is living with. So the psychologist's job becomes to address all of these issues. So not only are you providing support and guidance, and you're counseling them and trying to help them navigate through this really challenging time in their lives with a malady that is not physically visible and cannot be seen on any X-ray or MRI. So not only are you doing that, but also you are giving them skills on how to manage their mood and their anxiety and their stress. Sometimes how to deal with relationships. We might have to bring the partner into the discussion periodically to address strains in the relationship. At times, people start turning to different substances in order to cope. So that problem can arise. Sometimes it's overuse of medication. So it can be a really huge thing, a big thing to address. But the most important piece here, I guess, that I want to stress is that a concussion is not really a simple thing. It's not an inconsequential thing. Very often, it's not taken very seriously. It can be very serious. And if a person is suffering from a concussion, it does require attention. So in conclusion, I'll say this is definitely not a comprehensive or definitive video on the topic of concussion, as you can imagine. There are other disciplines that come into the picture in the treatment of concussion, occupational therapists, physiotherapists who are trained in the treatment of concussion, and then, of course, various other medical specialists as well. So it's very complicated. It's a very big topic, but hopefully I have at least lent a little bit of depth to the understanding of concussion in this video and contributed something positive as a result. Thanks for watching. Have a great day.